Some people simply avoid going to the doctor or avoid going to the dentist because they think either it's a waste of money or it's a scam or they don't have enough time, or they think that they don't really need to go because they already take pretty good care of their mouth or their health. Now, if this sounds like you when it comes to going to the dentist, you might be okay, especially if you do take care of your teeth. But there are some warning signs that you should definitely not ignore. And if it happens to you, then you should definitely make sure you go to the dentist right away. Now, I'm gonna go over a lot of these signs in this video, so make sure you stick around. The first sign that you need to go right away is if you have any swelling or any abscess in your face or your mouth area. Sometimes if a tooth gets infected, it can get like a little bubble or like a pimple-like lesion surrounding it by the gums. And sometimes that pimple-like thing will pop and it won't really swell up, but it will form something called a fistula. And this fistula will just keep draining. So you'll have an abscess in your tooth and it'll just keep draining into your mouth and it won't really like balloon up. If this happens, you could start to get really bad breath or this really bad taste in your mouth because it's essentially just this pus that's leaking from this infection into your mouth. There's also a chance that a dental infection could really balloon up and not only just spread in your gums, but also spread to your face. And it can even spread to your jaw and start ballooning up underneath your jaw. If this happens, it can be really scary because now it's spreading away from your mouth and into other parts of your body. And at this point, if it's ignored for too long, it could make you really sick or it could even kill you. For example, if you get this swelling that gets underneath your jaw from a dental infection, that means it's spreading to your lymph nodes, specifically something called your submandibular lymph nodes. Now from here, this swelling could really balloon up to the point where it cuts off your breathing entirely. Now, some other signs that you have a dental infection aside from tooth pain are things like a fever or having general fatigue. Now, the second sign that you need to go is a persistent toothache. So a toothache doesn't always mean that it's something terrible to happen. For example, sometimes your teeth could simply hurt because you've been grinding your teeth at night. So if your partner ever hears you or if you know that you clench or grind your teeth at night, then this could cause you to wake up with some jaw pain, headaches, ear pain, or even for your teeth to be in pain. If you've been on top of your dental visits and you've been going every 6 months and you take care of your teeth pretty well at home and all of a sudden you have toothache one morning or something like that, but it ends up going away the next day, then you might be okay. You might not want to worry about it too much. I'd still recommend going to get it checked out. But if you haven't been to the dentist in a while and all of a sudden you have a sharp tooth pain and it's lasting for more than a day, like a day or 2 or 3, then I would definitely go right away because there's a good chance that something is going wrong that you need to get fixed ASAP. Usually dental pain doesn't happen until something gets really severe. So if you have, for example, a cavity in your tooth, a cavity is a hole that forms in your tooth. Typically, this doesn't hurt right away. For some people, that tooth might be a little more sensitive or something like that, but even that, it doesn't really happen until that cavity gets really big. Once that cavity gets so big to the point where it's basically affecting your nerve, this is when it can start hurting you quite a bit and waking you up at night and potentially lead to an infection. If you have this persistent toothache, some things to look out for are things that make it better or worse. So is it like a sharp shooting pain that spontaneously happens, or is it a pain that only happens when you're chewing something, or is it a pain that only happens when you drink something hot or cold or eat something sweet? All these things may seem unimportant, but they're actually really important in helping diagnose what the problem is. Regardless, you're gonna have to go into the dentist right away and they're gonna help you see what's going on. Now, the third thing I want to talk about are bleeding gums. Now, specifically when bleeding gums do not seem to stop. So bleeding gums are an obvious sign of gum disease. Your gums should really never be bleeding, especially when you're just brushing or flossing. Unless you cut yourself or do something that you're not supposed to with your gums should never bleed. And if they are bleeding, that's an obvious sign that you need to brush and floss better to clean these bacteria away and get rid of this inflammation that's happening. And then over time, as you clean it properly, then the bleeding should stop. But if you notice that your gums are persistently bleeding and they're not stopping, then this is a huge problem. Now, it might not even be something that's dental related, or it could be dental plus something else. Like for example, you could have some blood clotting problem where your blood simply does not clot as well. And in this case, you should also go to your doctor to see if you need any adjustment with your medication or something like that to make sure that your wound healing is gonna be okay. Because the last thing you want is for you, for example, to cut your arm or something like that, and that bleeding to keep continuing and not stopping, and then you might get an infection there or something like that. So that could be a possibility too. But persistent bleeding with your gums could also be a sign of advanced gum disease, something called periodontitis. Periodontitis is when this gum disease starts spreading below your gum levels. So typically when you go to get your cleanings done, they're cleaning around your teeth and a little bit underneath your gums, but they're also measuring your pockets around those gums. So those pockets that they're measuring at the dentist, like when they're probing around your gums and they're shouting a number like a 3, 2, 4, or something like that, those numbers are a measurement of your sulcus. So everyone's gums around their teeth has a sulcus, which is like this pocket that forms around their teeth. And the sulcus is not attached to your teeth. It ideally should be firm around your teeth, but there's no attachment gluing it to your teeth. If that sulcus starts to get deeper, that means it's a sign that this bacteria has gotten deeper underneath your gums, and that inflammation that those bacteria cause have started eating away that attachment underneath your gums. And this leads to deeper and deeper pockets. So anytime you have a pocket that's deeper than 3 millimeters, this is a problem. And if it's deeper than 4 millimeters, then you know you have some active gum disease going on. Some other signs are if you see some pus coming out of your gums when you push on them or something, or again, if you have a really foul taste. These are all signs that you have this advanced gum disease, and if you do have this periodontitis, it has to be treated as soon as possible, because what happens is as these bacteria start increasing these pockets and start spreading below your gums, they start eating away at the bone and the attachment to your teeth. This is the #1 reason that people end up in dentures and end up losing all their teeth. And it's because these bacteria are not being cleaned away and they're lying underneath your gums and eating away your bones slowly and slowly. And if you keep neglecting the dentist, then it might be too late to save them. Now, the 4th sign that you need to go to the dentist that might be a little bit more specific is if you have tooth sensitivity, but it lingers. So for example, if you eat like a cold ice cream or drink something cold and your teeth feel sensitive for a second and then it goes away, I'm not too worried about that. That's more normal sensitivity. Now, there are ways to address that type of sensitivity as well. Like if you use a sensitivity toothpaste or even other fluoride options or something, you can talk to your dentist about that, but it's not like an urgent sign. But if you have like a really sudden, intense pain when you're drinking something cold, or if you have this sensitivity and it doesn't go away right away, like you drink something cold and then that pain is there for like a minute or two and it just stays there and it doesn't go away, that's a really bad sign. This is actually a sign of something called irreversible pulpitis. What this means essentially is the nerve that's inside your tooth is super aggravated. So you might have had like a cavity or something there, or you might have had an old filling, or you might have had some trauma to that tooth from just even from the way that you bite, it could cause it. There's a ton of things that could cause your nerve to be super aggravated. But the bottom line is your nerve is super angry and it's not gonna heal itself. Once it gets to this point where it's lingering for a minute or two and it's not going away, then pretty much always you have to get a root canal. This is actually a really common test that the dentist does. So if someone comes in with tooth pain, they'll do their checks to see what's going on with the tooth. And one of the checks is to put something cold against the tooth and then see how that person responds. If that person responds with that hurting for a little bit, but then it goes away, that's not too bad. But if it starts hurting and it stays there for like a minute or two, then that's a pretty much obvious sign that that tooth needs a root canal. A root canal is where the nerve inside the tooth is removed. And this is pretty much the only way at this point to get rid of that pain in that tooth. The only other option is to extract the tooth. Now, could this be something else going on if you're having some sensitivity and it's lingering for a while? Yeah, there's a chance that obviously you should be going to the dentist and having a professional do their own tests to make sure that they're doing the right thing. But if this does happen to you, definitely go right away. Now, the 5th bad sign I want to talk about are loose teeth. Now, I'm mainly talking about adult teeth, because when baby teeth are loose, that's usually normal because it means the adult tooth is coming in. But if an adult tooth is loose, even a little bit, then this is a huge problem. It could be either gum disease that's gotten so severe, that periodontitis I was talking about, and spread to the bones and eaten away so much of the bone that your teeth are getting loose. Typically, if it is gum disease related, those first 2 teeth that are gonna go are those lower front incisors. And that's because this is where most of that tartar or that bacteria will build up. And also these are the weakest teeth in the body. But you could also have localized gum disease in one specific spot. So everything else feels fine, but that one spot's getting loose. Or it could be a crack. The most common teeth to crack are your lower molars. Those lower teeth in the back that are meant to do a bunch of that chewing. And that's just because the amount of force that we put on those lower teeth when we're chewing foods and stuff like that, especially if you start doing things that you're not supposed to, like grinding or clenching your teeth or putting things in your mouth that you're not supposed to. The bottom line is your adult tooth should never feel mobile. They should never feel loose. And if they do, it's a bad sign. You should go right away. Now, the last major sign I want to talk about is jaw pain. Now, jaw pain might not be an emergency, but sometimes it could get to that point where it's hurting so bad. And some people might not even realize that your dentist can also help with jaw pain. So a lot of times if you have pain in your jaw or by your ear or in your head, it could be related to your TMJ or your temporomandibular joint. That's basically this joint in your jaw here that helps you open and close and chew your food. A big sign is if you wake up in the morning with this pain. So if you ever wake up specifically in the morning time and you have jaw pain or headaches or tooth pain at that time, then that's a huge sign that you have this TMJ problem. And usually this comes from grinding and clenching your teeth. So a lot of times people, when they're sleeping, they don't even realize it, they will grind their teeth all night long, or they'll clench their teeth together. This not only can damage your teeth and make your teeth more prone to cracking or chipping or something like that, but it puts a ton of pressure on your jaw joint and it creates a lot of inflammation. And it also puts a lot of pressure on your muscles, in your head muscles and your chewing muscles. And it can lead to them all being sore. And this is how you can get that ear pain or that jaw pain or those headaches. Typically, the easiest solution for this is getting a bite splint made or a night guard. This is basically like a plastic retainer that's a little bit thicker and it just goes on one arch, either your top or your bottom. And instead of grinding your teeth with this, it'll deflect those forces. So your teeth will kind of glide back and forth on this instead of putting all that pressure. So this can get rid of a lot of that pressure that's in your jaw and in your chewing muscles and also protect your teeth. And for a lot of people, this can help eliminate that pain that they wake up with. Now, you might not be grinding your teeth at night, but you might be doing it during the daytime and still you can have the same symptoms. But the solution could be the same. You could wear this night guard whenever you end up grinding your teeth. So if you end up focusing on something like when you're working or something like that, or when you're driving, then you can still pop in this bite splint to protect your teeth. Now, if you want to explore grinding and clenching a little bit further, it could also be sleep related. Now, there's a lot of new studies coming out, the relation between sleep problems, like breathing problems when you're sleeping, for example, related to grinding your teeth at night. Now, I'm not going to dive into that in this video because it's a little bit more complicated and I don't want to bore you with that, but I'm putting a link in the description below where you can learn more about that, where I made a separate video on that. Now, with all these problems that I talked about, these are all urgent problems that you should get checked out right away, because these are all signs that will either A, cause a lot of pain, or 2, a possible infection, or 3, lead to inflammation or an infection that spreads to the rest of your body. And in all these situations, the timing is important because, for one, the earlier you address it, the earlier you get out of pain. But also you can prevent damage to other areas. Like we talked about, for example, if you have an infection and it spreads to your face and it spreads underneath your jaw, then this can cut off your breathing and even kill you. So the timing is really, really important. So anyways, thank you guys so much for watching. I hope you liked that video. If you have any questions, just let me know in the comment section below. And as always, make sure you hit that thumbs up button and subscribe to my channel below as well. I'll see you guys in the next video. Did you know that the health of your mouth could also be affecting the health of your brain and your heart? That's because the bacteria that live in your mouth don't just stay in your mouth. They can also spread to other parts of your body. And they even play a part in things like Alzheimer's. And if you have gum disease, and if you have bleeding gums, the bacteria that are in that gum